So let's talk about heart failure. The term itself makes it sound as if the heart has failed and is no longer working at all. But actually, heart failure means that the heart isn't pumping as well as it should be. In technical terms, heart failure can be defined as the inability of the heart to maintain a sufficient output of blood to meet the demands of the body. Basically, the heart isn't able to keep up with its workload. A normal healthy heart is a strong muscular pump made up of 4 chambers, 2 on the right and 2 on the left. The upper 2 chambers are called the atria and the lower 2 chambers are called the ventricles. The right atrium receives deoxygenated blood from the body and pumps it to the right ventricle. The right ventricle then pumps the deoxygenated blood to the lungs via the pulmonary arteries. After gas exchange, oxygenated blood travels from the lungs to the left atrium via the pulmonary veins and then into the left ventricle. The oxygenated blood is then pumped out to the rest of the body via the aorta. There are 4 main types of chronic heart failure. Left-sided heart failure is when the left ventricle doesn't pump blood efficiently. Instead, fluid backs up into the lungs. Right-sided heart failure is usually prompted by left-sided heart failure. Blood accumulation in the lungs stresses the right side. Due to this, fluid backs up into the abdomen, legs, and feet. Systolic heart failure is when the chambers are stretched, thin, and enlarged, resulting in the ventricles not being able to contract and pump with enough force. There is a larger filling capacity but a smaller ejection of blood. Diastolic heart failure is when the heart muscle becomes stiffer and thicker, resulting in the ventricles not being able to fill properly. There is a smaller filling capacity and ejection of blood. Heart failure can be caused by many cardiovascular diseases or conditions. Some examples include hypertension, damaged valves, cardiomyopathy, congenital heart defects, and coronary heart disease. This is one of the most common causes of heart failure. As you can see, heart failure rarely occurs in isolation and is usually present due to a previous cardiac disease or condition that ultimately results in an increased workload on the heart, an example of comorbidity. Over time, this damages, weakens, or stiffens the heart muscle and myocardial cells, resulting in heart failure. The most common signs and symptoms include the following: dyspnea, the shortness of breath. Blood backs up in the pulmonary veins, causing fluid to leak into the lungs. Persistent coughing also occurs due to this. Blood returning to the heart through the veins backs up, causing peripheral edema, which is fluid buildup in the tissues. This results in weight gain and swelling in the feet, ankles, legs, or abdomen. Fatigue and difficulty with everyday activities also occurs, since blood is diverted away from less vital organs. Similarly, the digestive system receives less blood, causing a lack of appetite. An increased heart rate also develops as a mechanism to account for the heart's decreased pumping capacity. Data shows that 29.2% of Australians aged 75 years and older had heart disease. Out of those who have had a previous heart disease, 22.6% developed heart failure. There are 61 deaths related to heart failure every year, and heart failure is also almost twice as more common to occur in men than women. Since heart failure is a secondary diagnosis, it is also important to understand the epidemiology of cardiovascular disease. 1 in 5 Australian adults have cardiovascular disease. For Indigenous Australians, hospitalisation and death rates are twice as high compared to non-Indigenous Australians. Also, these rates are 30% higher for remote areas compared to major cities. With current data, trends show that the overall prevalence of heart failure is rising in Australia.